Having recently retired from the military and serving at Walter Reed National Military Medical Center for 5 years, coming back to the community, coming to Auburn, I noticed that there was a bit of a lack of awareness of the issues that are facing the returning wounded, the returning veterans and service members to the community. And I began speaking with some of my colleagues at the School of Nursing, and then we began to talk, and we said, well, we thought about a program that would better educate the students on these issues so that when these students graduate, go out in the community, they are capable of managing this type of population. So Project SERVE is the student education related to the veteran experience. It's important for our students to understand these unique needs because a lot of people don't realize that less than 50% of the returning wounded will actually seek care through the VA or a military treatment facility. So greater than 50% are actually going to be seen in the community.
Project SERVE is a 2-hour elective broken into 3 components: pre-deployment, deployment, and post-deployment. The pre-deployment is getting students ready and the information they need to learn about caring for the wounded warrior, veteran, and service member. The second phase is the actual experience. It's 5 days at Walter Reed National Military Medical Center, and we do a lot of activities such as a war memorial tour all over Washington, panel discussions with family members, researchers, caregivers, physicians that are caring for the wounded. We do clinical rotations from acute to chronic that look at all the different spectrum of where the patient enters to where their recovery begins. We do also tours on Capitol Hill to see the political aspect of that. The last phase is the reflective piece, and that's hugely important because it's the student's way of giving information on now their perceived level of competency to care for the wounded. They also are letting us know the knowledge, skills, and attitudes that are needed to develop national competencies that are being used to learn to care for the wounded warriors and their families.
I would definitely recommend this experience to other nursing students, primarily because it really promotes and shows that brother and sisterhood that you get to experience in the military. I experienced it in the Navy, and actually having done this experience would have made me consider going back in, and I think that is a wonderful thing for other students because it kind of opens that door. They might not have necessarily been considering, joining the military, but even if that's not an option, just being able to see and expose yourself to these type of situations so that you have that confidence when you have someone come in a regular hospital setting. And I think that with the advances that the VA is starting to make, that we're going to see more and more individuals come in that have been deployed, and it's just very crucial for us to know what to ask and how to treat and develop goals for these patients.
I think this experience will help me seeing patients with similar injuries because after being at Walter Reed and seeing the standard that they've set for care when it comes to injuries like traumatic brain injuries or amputations, and being able to experience that care firsthand, it really showed me that no matter how a patient got their injuries, they still need to be afforded that same level of care. And since I've experienced that, I can give that to them.
These soldiers want to be a part of their own care and want to do whatever they can to help themselves recover and not just have us do everything for them. Before, I didn't really think about them as being around my age, but they're all, around my age, and they're receiving these terrible injuries, and it's changing their life forever, and they're only 19, 20 years old.
There was one gentleman that came in and talked to us about his traumatic brain injury, and every single person in that room was crying. And just from the things that he told us that he experienced, and just the positivity that he had to live life better, and he got a second chance. And that was it didn't just touch me as a nurse, but as a person.
There definitely are patients who will stick with me forever. One particularly stands out, a guy that we watched in the physical therapy unit. He had lost both legs and an arm, and just to watch his positivity and the way he gave everything he had to get better and to try to push himself to walk and just to get back to where he was before definitely will stick with me.